At Healthy London Partnership, we have a prevention programme, and within that we do work with communities to improve population health. And in our projects we've worked with the voluntary community and social enterprise sector.
Social enterprises particularly have grown a great deal over the kind of last 5 to 10 years, so there's many more in London and across the country than there were before. About a third of social enterprises in the capital, in London, are delivering health and social care in different ways, and for us that means it's a really important area to focus on.
What we've discovered is that there is a real value add in working with these organisations. So they know their local community really well, so they're able to tell you things about the way the community is organised that help you create unique solutions for that place that will work for those people.
So I really welcome this guide. It's a terrific piece of work in one place. It first of all celebrates the really good work of the voluntary community sector and social enterprise, but it also does what Healthy London Partnership do very well, which it puts good practice together, it puts the knowledge in one place, but it also it shows how innovation can happen in a sector like this, which is very often further than we can go.
What commissioners do need to recognise is that there are some organisations, local organisations, who provide critical services that achieve outcomes for health that can't be achieved by anyone else, and that if those organisations didn't exist, then the sort of sustainability of NHS services would flounder.
In the Isle of Dogs in the past we've been really successful in sort of achieving good breast screening rates because we've been really able to lock into actually very, very local, small community services and providers.
Small charities are seeing the drop in commissioning of their services, and commissioners are statistically favouring larger charities. But yet we know that the smaller charities are the ones that have the real personal connections. They're the ones who understand the complexities of the communities within which they're operating.
But also we're seeing charities wanting to be more enterprising and earn more of their income, not relying so much on grants and donations. So we've seen that kind of growth in the enterprise side of this work.
So I think it's really important for commissioners to recognise the value that those small charities can offer.
How do they build recognition of that additional value into their commissioning? So using levers like the Social Value Act, better ways of doing procurement in such a way that it can be accessible to smaller organisations as well, and really understanding how the full range of organisations can contribute to the goals that they're trying to achieve across a population footprint.
Like in any sort of market development situation, you would want to sort of have make sure you've got good, high performing but also sustainable organisations. But there is, as commissioners, you've got a role to sort of support that.
How do we use finance and investment differently? How do we use that to achieve the social objectives we're trying to get to? And have we got more sustainable models within the social sector which can help take that investment and really achieve what these organisations, but also the commissioners, are seeking to achieve?
Those organisations which have been able to be sort of more sustainable within Tower Hamlets are those who have diversified.
They can often leverage different resources and assets that are in that community as well. So sometimes that's people, sometimes they can mobilise volunteers and people who otherwise wouldn't get involved, but sometimes that's actual finance and investment that the public sector might not be able to access, might not know about.
I think charities are having to adapt to the changes in commissioning. So for some of them that means that they're diversifying their income streams and they're looking for sources of funding that they haven't turned to before. So they might be turning to the local communities themselves, or they might be reaching out to foundations and trusts.
So I think key for us in Tower Hamlets has been about establishing forums where we do have that engagement. We do, through that process of our developing our own commissioning intentions, use the voluntary and community sector to help us inform some of that, because again, recognising they understand our population probably better than we do.
When I speak to a lot of small charities, what they're telling me is that they need different skills surrounding them. So if commissioners are able to really get under the skin of the challenges of small charities and understand whether there are skills that within the commissioners that can be shared with those small charities, I'm sure they would really be appreciated.
So can they maximise the social good they can do from their procurement? And social value is one way of approaching that and thinking about that.
I think we would love to encourage commissioners, and this guide does that, to harness the same capability that we've been able to through our engagement with the VCSE sector in addressing local needs and going further and faster with the things that you want to achieve locally.
So the guide is a great step towards explaining, first of all, to commissioners what is on offer, what could be, but also beginning to build perhaps a firmer relationship about, we do need to help the providers in this sector to be able to give the best offer they can give, rather than spending all their very scarce resource on just navigating our system.
Increasingly, we know, as the National Body for Social Enterprises, we're part of the answer, we're not the whole answer, and neither is the public sector the whole answer, and neither indeed are the private sector. We need to work together on this stuff, agree where we're going, agree what our shared strengths are, and really work together on how to achieve what we want to.
So I think commissioners need to recognise that they can achieve health impacts, health gains in an affordable and effective way through partnership with their local voluntary community social enterprise sector.
Actually, we're not going to be able to achieve keeping more people out of hospital, joining up health and social care, helping people look after themselves better, unless we work with charities and social enterprises on the ground.
So I really welcome this guide for commissioners, and I hope it really ignites their passion for working with small charities and the communities that they serve.